number of children with autism is way up, according to the Centers for Disease Control. It now estimates that 1 in every 88 children is autistic. Take a look at how quickly the rate has shot up. In the year 2000 and 2002, it was about 1 child in 150. 2 years later, 1 in 125. Then 1 in 110. And now the latest report from 2008, 1 in 88. That's a 78% increase over the last decade. But why? Our chief medical correspondent, Dr. Sanjay Gupta, with us now to help answer that. Sanjay, frightening to parents to hear those dramatic numbers. Do we know why such a dramatic increase?
Well, you know, John, when they do these types of surveys, the Centers for Disease Control and Prevention, it's what's called an epidemiological survey. So they're looking at numbers specifically. They're looking at the number of 8-year-olds who have autism in this country at any given time. They're looking at specific communities and then extrapolating. They're not trying to figure out causes with this type of study, although that is the question everyone's asking. Part of it is probably because we're paying more attention to autism than ever before, and so there's greater awareness and, as a result, also greater detection. But even if you account for that, the numbers still seem to have increased. People always say, John, it's a combination of genes and environment. But I will put this forth, and that is that, you know, our genes in our human bodies, they don't change that fast. They wouldn't account for a 78% increase over 10 years. It takes hundreds of years for our genes to change, so it's definitely more environment. Toxins, infections, exposures. It could also be that parents are having kids later in life, and as a result of that, that could be a risk factor, or the fact that the parents themselves have accumulated toxins in their bodies, and that could be the risk factor. We don't know the answer, but all this information is worth something, and it's causing us to drill down more on what might be causing this.
And does it make any difference? The earlier you detect, the earlier you have a screening, does that have anything to do with sort of the care going forward? Does the child have a better chance if you detect it younger?
I think it absolutely does, John, and I think that's not just a platitude, because you hear this all the time with regard to medical issues. Diagnose it early, treat it early. In this case, it really is important, and I would say that even in the youngest kids, really looking for signs, and parents, you know, they're observing their kids more than anyone, so looking for specific signs in kids between the ages of 6 and 12 months, for example, even that young, the kids should be babbling at that age. They may not be saying words, but if they're not babbling, that could be a concern. If they're not making eye contact, for example, with their parents, if they're not as engaged, they don't reach for people or gesture in some sort of communication or reach to be picked up when a parent walks by, those could be concerns. None of them individually, you know, make a diagnosis of autism by any means, and I have young kids, and I know kids can behave very differently even among siblings, but you know, if there's a pattern of things, get it diagnosed early, get it treated early, and the early intervention seems to make a big difference. Trying to teach kids social engagement, even as young as 18 months, can make a difference for those kids going forward.
And the costs, though, are astronomical. Researchers say as much as $3 million over a lifetime. Do most health insurance plans cover this, beginning to end?
I don't think most insurance plans cover this. A lot of the cost, on a family is out of pocket. It's a huge toll on couples. There's, I think, close to an 80% divorce rate, for example, among couples who have a child with autism. So it's a huge toll.